Doctors, good to see you. My home state is in good hands this evening.
Thank you.
Let me talk to you about the market. Clearly rallying yesterday and in some respects for the better part of today on these improving numbers, specifically out of New York. Are you as optimistic as the market is suggesting?
Well, look, the numbers are improving. We should acknowledge that. The numbers in New York, that city's probably going to be entering a plateau. They'll bounce around the top for some days, and then they'll start to come down. But by next week, we might see the number of new cases starting to decline. Hospitalizations will continue to increase for a couple of weeks, but the new cases will start to decline. That's true of most of the North and the Northeast, as well as the Pacific Northwest, which has been declining over a longer period of time. There's still growth in cases in the Southeast. You see Florida reaching 15,000 cases, Louisiana 16,000 cases. The hotspots in both of those states, Miami and Florida and New Orleans and Louisiana, are doubling every 2 to 4 days right now. So there's still rapid growth in cases in those two states. And I still think Georgia and Texas remain question marks. You haven't seen an acceleration in cases in those states, but they're still under testing, and you see hospitalizations going up. So there's still some concern. So we're not out of the woods yet, but I think we're starting to see the light at the end of the tunnel in terms of when this epidemic is going to peak nationally and when we can start to contemplate releasing some of these really onerous population-based mitigation tactics that we've been employing, basically keeping people in their homes. We'll make that transition in May. I think there's still a lot of uncertainty going forward. What happens in June and then what happens again in August? And I'm not sure the market's really anticipating that. I think that there's a lot more uncertainty around what the fall looks like than people are really starting to factor in right now.
I'm wondering how you're thinking about the numbers themselves and if you think we can truly trust them. There are some alarming reports tonight that a lot of people are dying at home and not in the hospital. Therefore, they're not being counted in the official numbers. What are your insights on that?
I think most deaths in this country get reported and the cause of death gets reported. I'd be very surprised if there is any kind of dramatic underreporting in the U.S. right now. It is true that systems are overwhelmed and there's going to be underreporting on the margins at hospitals and outside the hospital setting. We're clearly not diagnosing all the infections. There's a lot of infections happening in the community that aren't making it into official statistics. There was a study out in the British Medical Journal today saying that as many as 4 out of 5 cases may be asymptomatic cases. That's high relative to other analyses, but we also know that there's probably a lot of asymptomatic infection that's occurring that we're not counting. So the number of cases is higher. Probably there are some deaths that aren't getting reported. There were some early deaths probably that weren't reported. But by and large, I think hospitalizations, people who are infected and hospitalized, and people who succumb to the infection, I think those are by and large making it into the official statistics. That's why when we look at trying to track what the scope of an outbreak is or epidemic in a state, the first thing to look at is the hospitalizations, because people who get hospitalized with the infection are going to get counted more reliably than people who are just diagnosed with infection and might be at home.
Speaking of hospitalizations, now half of where they were a week ago in New York. The number of ICU trips are down. That's significant. Can we, for the first time, doctors, say that the curve is indeed flattening tonight?
I think the curve is starting to flatten. I don't think we're quite there yet, but you fit a line to a curve, and generally it's reliable when you do this kind of modeling. And unless we really did something to pull back the measures that are now implemented, which we're not going to do, we're going to continue with the measures until we see a real trend. Unless we were to pull back right now, I think the trends are going to continue. We're going to see these new cases start to plateau over the course of this week, especially in places like New York, and hopefully start to come down. The new cases, we're still going to have new cases on a daily basis, but the number of new cases will start to come down. One thing to remember is what happened in Italy was when they reached their plateau, they bounced around for a little while. There were some days that looked worse than others, and we thought maybe Italy hadn't plateaued. But they stayed flat for a number of days, and they sort of bounced around that top before you started to see the declines. That's a result of the mitigation. What the mitigation does is it stretches out the epidemic, but it pushes down that peak. That same thing's going to happen here, where you're going to see New York bounce around for a number of days. There'll be days where it looks like they might be going back up again, and then the next day they'll be down again. And that's going to happen, and then by next week we'll start to see, I think, steady declines.
Doctor, stay with me if you would. I want to bring in our Contessa Brewer now. She is following how New York is thinking about the key question, how to safely get back to normal. Contessa, what are you learning tonight?
Well, look, we're still in the middle of a crisis in New York, but the governor, Andrew Cuomo, is starting to tackle a plan on how you move millions of people back to work. To start with, he's coordinating that task with the governors of New York, of New Jersey, rather, and Connecticut.
We try to operate to the best we can as that regional collaboration, and that has been working well for us on schools, on the economy, on health care issues. We have to start planning restarting life. We're not there yet, but this is not a light switch that we can just flick one day and everything goes back to normal. We're going to have to restart that economy. We're going to have to restart a lot of systems that we shut down abruptly, and we need to start to plan for that. My personal opinion is going to come down to how good we are with testing.
And look, it's clear that he thinks we're going to have to start the process of getting back to work before we've truly conquered coronavirus. To that end, they're saying testing is absolutely crucial because they don't want to send a bunch of people back to work and then see another viral outbreak. The Department of Health in New York State has developed its own antibody test for COVID-19. That is, those antibodies that show whether someone has contracted the virus and now has recovered. And now the state is going to invest in private companies to ramp up that rapid testing so they can deploy it. The governor is also urging the federal government to give more aid to the state and local government. They've lost so much in tax revenue. He wants to see that in the next relief bill. And he has tapped two former aides, Bill Mulrow, who's a senior advisor at advisory director at Blackstone, and then Steve Cohen, who's an executive vice president for holding company McAndrews and Forbes, asking them to help create a plan. And Governor Cuomo says he's looking at this return on a regional basis, on a staggered basis, and definitely to choose workers to go back who are less vulnerable to infection. Scott.
Contessa, thank you. That's Contessa Brewer reporting tonight. Doctor, I turn back to you then. Talking about reopening, you said, quote, today, we are looking at an 80% economy where certain things don't come back. I think we'll get the technology, but we only have 4 months to do it. Are we going to meet the challenge?
Well, what we need by the fall is massive surveillance testing capacity, basically the ability to test people in the community and find out who's infected, actively infected, and good interventions to try to isolate individuals who have infection so that they don't spread it. So we don't have to go back to these population-based tactics. And ultimately, we need a therapeutic. It doesn't need to be a cure, but it needs to be effective at maybe prophylaxing people, preventing people from getting infected who are exposed, and maybe treating some people who might be more vulnerable to the infection, more likely to have a bad outcome. Will we have those tools? We need them. If we don't have those tools by August or September, we are going to face the risk of large outbreaks and maybe another epidemic. I think we'll have those tools, but there needs to be a concerted policy to try to address this. It's not clear who owns this right now, but the government needs to be marching towards trying to get these kinds of capabilities. And remember, what we need in the community is point-of-care diagnostics to diagnose active infection. People talk about serology, basically looking for antibodies for people who've been exposed to the infection and now have some level of immunity. That's good for certain kinds of decision-making, but when we deploy those serological tests broadly to see who's been exposed and who's now immune to this, my guess is, based on the data we're seeing, we're only going to find maybe 3 to 5% of the population at most right now has been exposed to this and developed any level of immunity. It might be less than that. It's not 30 or 40%. So there's a lot of people who think that they had this at some point in January or February, and we think that there's a large pool of people who are now immune to this. That's not going to be the case.